All right, so today we're going to talk a little bit about red flags for autism and what a parent and caregiver can look out for. One of the most important things to consider are what are called developmental milestones. So these are basically checklists of at every age and every stage of development behaviors that your child should be doing. So the symptoms of autism spectrum disorder typically appear early on in a child's development. A third to half of parents say that they actually thought that something was not right with their child by 24 months of age. And so starting during infancy, we really want to start looking at these signs that might be showing up in children as they develop. So for example, by 6 months, infant should be smiling back and forth to their parent, where we're looking for some kind of social engagement by 6 months. By 9 months, they're engaging in what we call joint attention, which is sharing attention. If you, for example, look at something, your child's going to turn and look as well. That comes in around 14 months, pointing around 9 months. First words should be coming in around 12 months. So these are all developmental milestones that we look for along the road in a child's development to make sure they're hitting the targets that they're supposed to be hitting. So we really look for deficits in the areas of communication, social skills, turn taking, those kinds of behaviors. And then also we can see some troubling behaviors that might start to exhibit around 18 months, 2 years old. Maybe your child has a sensitivity to smells or tastes or sounds in their environment, or maybe they engage in some repetitive behaviors like flapping their hands. If they do learn to talk, they might be echoing back what you're saying, which, repeating words over and over again instead of communicating functionally. So these are all behaviors that we look for in a child when we are evaluating them for an autism spectrum disorder. So again, the best thing we can do as parents and caregivers is to really try and catch things early, being vigilant, making sure your child's meeting all their milestones when they should be, following up with your pediatrician if you have concerns. 6 months, 9 months, 12 months, there's checklists you can find online for what your child should be doing, and really just making sure that they're moving forward in their developmental progression.